Jessica DeMassa, and I'm here at the HISA Studio here at HIC 2017. I'm here with Mark. Mark, can you please introduce yourself for everyone watching?
Yeah, hi. My name's Mark Santamaria. I'm an emergency physician working at the Alfred Hospital in Melbourne, and I'm here really for clinical informatics.
Okay, so tell me a little bit about clinical informatics and how that's come about here at HISA.
So clinical informatics is really involving clinicians in the application of digital health. And it's also in the use of big data in health analytics and how we might translate that into clinical practice. And one of the big issues is how do we engage the clinical community into this sphere of health informatics and also clinical informatics.
So how do we do that? What is the trick?
Well, one of the things that we have is a community of practice within HISA, which is a group of interested clinicians who are really going to be sharing some of their experiences, some of their problems and, wicked problems, and also to support each other in developing a community that will hopefully shape the digital future.
That's fantastic. Are clinicians really interested in getting involved at the informatics level?
Absolutely. If you talk to any of the junior medical staff, they are ready for digital health. In fact, they really don't understand why it's not there already. And, they also don't understand why it's not available on their phone. And I think that it's about trying to harness that enthusiasm that the junior staff have and encourage them to actually then take it on. The other thing is that we are implementing systems that they're going to be living with for a long time. And the people that are implementing them are going to be retiring in the next 5 years. So, I think it's really important to engage them early because that's what they're going to be living with.
That's a very good point. So how are you bringing together, I guess, this new class of clinician and the older class of clinician that's on their way out?
That also is a great challenge. And the thing is that we do see a lot of the older clinicians who are gradually realising the benefits of digital health, particularly when they can see the data that they get from the clinical information systems and how that can help them to manage their patients, particularly those that have chronic disease management. And if we look at what is the fastest growing problem in Australia and the world, it's chronic disease management. And I think that the data that goes with this is going to help clinicians manage their patients better.
Mark, thank you so much for sharing your perspective. It's so interesting to hear from a clinician who's involved on the informatics side and working with the data. Thank you so much.
No problem. Thanks for your time.
Thanks. This is Jessica DeMassa. I'm here at the HISA Studio at HIC 2017.